Good morning, Dr. Desmond White, gastroenterologist. If someone have a heart attack and had a percutaneous coronary intervention or PCI with stenting done, and the patient later on present with black color stools, what are the possibility and what should we do? Let me share some cases that I've been seeing on a regular basis. Usually after a heart attack, the cardiologist will do an angiogram, and if there's a blockage or tightening of the coronary blood vessel, the cardiologist will put in a stent. The stent can sometimes cause blockage itself. So to prevent the stent from being blocked, the cardiologist will give the patient a blood thinner. Usually for the first 3 to 6 months, the cardiologist will give 2 blood thinners, usually clopidogrel and aspirin. These medicines are safe, generally speaking, but because they are blood thinner, they prevent a clot from forming in the patient's anywhere in the body. We want to prevent the clot from forming in the coronary stent in the heart, so to prevent the heart attack. But if the patient have another source of bleeding, such as a sore or an ulcer in the stomach or a growth in the colon, then this particular blood thinner will also make this thing in the stomach or the colon and any wound in the body to bleed. So if a patient after a heart attack, they will automatically be put on antiplatelet agent. If they present with black color stools, then they come to me, they have a few considerations. Number one, does the patient have digestive problem before the heart attack? If they have gastric pain before, then it will be likely that this is a gastric problem like an ulcer or maybe other more serious stuff. If the patient have been having intermittent blood in the stools or change in bowel habit, and I will wonder if the patient have anything in the colon, such as a growth in the colon that bleed when they're taking antiplatelet agent. So my consideration will be first, should we stop the blood thinner or not? The answer is we try not to stop the blood thinner. I know that blood thinner is causing anything in the body that is pre-existing to bleed. It will be logical to stop the blood thinner in a normal circumstance, but if you have a heart attack, have a coronary angiogram and stenting done within the last 3 to 6 months, stopping the blood thinner abruptly may lead to increased risk of a stent blockage. So my first point to the patient and the cardiologist is do not stop the blood thinner. Number 2, should we do a scope to find out where's the bleeding? Answer is yes. A scope can be done rather safely in a patient even after a heart attack. I've even performed scope on patients with a heart attack with a gentle scope. With the indication is real, we can still do a safe gastroscope. So when we do the scope, we look for anything that bleed. And the third consideration is, should we just scope the stomach or should we scope the colon? Black color stools, 90% are from the stomach, esophageal or the duodenal problem, what we call upper GI problem. But rarely, black color stools can be from a lower GI problem, such as a tumor in the cecum. So if the patient is elderly, say more than 50, 60 years old, we will discuss should we do the colonoscopy at the same time to make sure that the black color stools is not caused by a colon problem. The next consideration is, if we do the scope and we can find indeed something that a polyp in the colon, should we take it out or should we do another setting? Polypectomy in a patient with blood thinner will be a little bit tricky. If we don't take it out, we have to wait for another 6 months later. After that, it's safe to stop the antiplatelet agent. We stop the antiplatelet agent and we do the scope and take out the polyp. But this means another procedure, another cost, and the patient have to live with this polyp for the next few months. On the other hand, if we take out the polyp on the spot, we run the risk of bleeding. So depending on the size of the polyp, the level of suspicion, the competence level of the endoscopist, we can decide either to do it in another setting later on with stopping of the antiplatelet or do it while the patient has antiplatelet. I normally would remove the polyp during the antiplatelet, even though they are antiplatelet agent, because if we can administer sufficient treatment like injection with a medication or putting a hemoclip or other method, we should be able to remove the polyp without any significant risk of bleeding. So when a patient comes in for a black color stools after heart attack, there are many considerations that your doctor will have to consider. It's never straightforward. Dr. Desmond White.